All right, Jack. Patient assessment trauma. You have 10 minutes to complete it. You are dispatched to reported shooting. PD's on scene. You're updated en route. You have one victim with multiple gunshot wounds.
Good. BSI is my scene safe.
Yep.
Confirm this is my only patient.
Confirmed only patient.
Okay, mechanism of injury is going to be penetrating trauma. Okay, from a gunshot wound. I'm going to consider additional resources, and I'll consider C-spine precautions.
Okay, you walk up to him. He's laying on the sidewalk. You notice one of the officers has his gloved hand over his chest, and you notice a large pool of blood over his right leg.
His right leg. Copy that. So I'm going to make a general impression real quick. It's poor. Chief complaint is going to be the gunshot wounds.
Yep.
Is my patient responsive?
He is responsive. He's screaming that he's in pain. He's been shot.
Okay. So now I'm going into my life threats here. That major bleed on that right leg is going to be an immediate life threat, something that we need to take care of. So I'm going to place a tourniquet on that right leg.
Okay, tourniquet controls the bleeding.
Controls the bleeding, perfect. From there, I'm going to move into my ABCs. Just checking out here. He's talking to me, complaining. Sounds like his airway's protected, patent.
Yep.
Okay, moving down, I'm going to check his breathing. Is he breathing adequately?
He's a little shallow, but it is at 16 a minute.
Okay. As I'm at his chest here, checking his breathing, do I find anything?
Yeah, you have the officer move his hand, and you notice a gunshot wound to
Okay.
the upper right chest.
Okay, I'm going to have the officer keep pressure there, holding that seal on there while I open up a chest seal and place it. Boom, using a commercial chest seal with its own check valve in it.
Okay?
Because of it entering on this side, do I have anything on the back?
You do. It's a through and through.
Okay, I'm going to quickly take a minute here to make a minute. I'm going to place additional seal on the back. It does not have to be vented, but won't hurt it if it is. So looking at the breathing here, everything else is good. Respirations are good, a little shallow. Something we're going to address. I'm going to have my partner stand by with a BVM. What did you say the rate was again?
16.
16. We're going to have the BVM set and ready, but at this point it seems like the patient's capable of breathing. Checking circulation here. Do I have any additional bleeds to that one controlled by the tourniquet?
No additional bleeds.
No additional bleeds. Circulation, skin condition.
He's pale cold diaphoretic,
Pale cold diaphoretic.
and his pulse is rapid at 100.
Rapid at 100. Copy that. So this is going to be a priority patient for me.
Okay?
We want to make sure we get him to an appropriate facility, and we're gonna get our transport moving here. So with that, I'm going to do as much history taking as I can. We're going to get some vital signs as a crew. Whatever the law enforcement can inform me and whatever the patient can inform me of his encounter and history, just to kind of get an idea of what else could have been. Considering the C-spine stuff, did he fall after being shot? Was he running? Was he sitting on a park bench?
No, he was just standing on the sidewalk.
Okay. We'll consider C-spine. Is there any complaints of neck pain or anything like that this time?
No.
Okay. So position comfort might be the route for this gentleman. I'm going to move into my secondary assessment here. So I start checking the head. I'm going to go through. Due to gunshot wounds, I'm going to kind of be a little bit clawed here, trying to find any additional holes due to distracting injuries. Check facial structures, everything like that. Do I see anything?
No, he's clear.
Okay. Checking pupils.
Recoil reactive to light.
Okay. Going through the neck here, feeling along, checking for blood, holes, entries, and exits, anything like that. Do I have anything?
No.
Okay. Looking at trachea and JVD.
It is midline, no JVD noted.
Copy that. Moving down in the chest, avoiding the obviously gunshot wounds. I'm going to press in.
You feel a little crepitus on the right side. It is not flail.
Okay. A little crepitus on the right, not flail, noted. It's in the area of our chest seal as well. Moving down, I'm going to check. I should have my patient exposed already. I'm looking. Do I see any bruising, distended masses, or bullet holes in his abdomen?
Negative.
Okay. I'm going to go through and palpate. Any reports of pain or anything like that?
No.
Okay, moving to the pelvis. I'm going to push in and down. Do I have any sort of movement there?
No.
Okay, going on the left leg. Do I find anything?
No.
CMS intact?
Yes.
Copy that. Right leg.
Same
have a
thing.
tourniquet in place. Everything's good. No
Except
CMS
no
to be
CMS.
found. Yep. No CMS below tourniquet. Sign of an affected tourniquet. So right arm, I'm going down. It's on the affected side of the gunshot wound. So I'm going to check pretty thoroughly for any additional holes or anything like that. Do I find anything?
No.
Okay. Left arm, going through, checking, anything?
Clear.
CMS intact in both arms?
Yes, sir.
Copy that. So with that, we're transporting this patient. with the vital signs, I forgot what the blood pressure was.
I didn't give it to you. It was 110 over 75.
110 over 75, perfect. I'm going to get a large bore IV started on him. We're going to have LR hung and set, TKO. We're not going to flow anything at this time. Just kind of that permissive hypertension, let that or hypotension, let that bleed hopefully close up on itself, if anything in the chest cavity there. The breath sounds, like when I checked here,
They were diminished and present.
okay. So it doesn't call for needle decompression at this time, but we will be keeping a close eye on that if it starts to develop. And then as far as pain management goes, we're going to do the same thing. We're going to do fentanyl. We'll do 1 mic per kilogram. Try to help alleviate some of this gentleman's pain, as long as there's no allergies to it. And then, yeah, we're gonna we have him moving to the appropriate facility, and I'm just gonna keep reassessing every 5 minutes.
Okay. Anything else you want to add?
No.